Hi, my name is Sienna Houston, and for my clinical specialty, I chose a licensed practical nurse, or LPN. Typically, LPN's responsibilities in a workplace include observing and keeping track of patients' health, providing routine care, taking vitals, giving patients medications, whether that's oral medications or injections, assisting in tasks such as feeding, dressing, and bathing, and supervising patient care and other nursing staff. My reasoning behind selecting this healthcare profession specifically was because I am currently in the process of becoming a medical assistant and would later like to further that into becoming a nurse, and thought that a LPN was the best option for me. I take a big interest in becoming a LPN because of how interactive they are with their patients. I personally love being able to make connections with people that I come into contact with and work better doing more hands-on jobs and skills, which LPNs tend to do. Some other traits and skills I relate to LPNs with is time management skills and being able to make quick but smart on-the-spot decisions. LPNs fit into the healthcare system because of their involvement with caring for patients who are in need and providing medical skills. For my skill, I chose assisting and feeding a patient. Steps 1 and 2 of doing this is to first knock on the patient's door before entering the room. And step 2 is introducing yourself to the patient and telling them that it's time to eat and that you will be assisting them. Hi, I'm Siri, and I will be assisting you today. Okay. Steps 3 and 4. Step 3 is to introduce the food options to the patient and let them decide what they would like to eat first. Step 4 is to wash your hands and put on gloves. I have 2 options, chocolate and vanilla pudding. Do you have a preferred?
I have the chocolate.
Okay. I will wash my hands now. Steps 5, 6, and 7. Step 5 is to adjust the chair to make sure it is at a 45-degree angle or a comfortable position for your patient. Step 6 is to offer the patient the food. Step 7 is to lift the food up to the patient's mouth, making sure the serving size is adequate for them. Steps 8 and 9. Step 8 is to offer the patient water or their choice of beverage every 2 to 3 bites. Step 9 is when the patient is full or done eating, is to dispose of the leftovers and the trash. Would you like something to drink?
Please. I think I'm full.
Steps 10, 11, and 12. Step 10 is to clean up your patient's hands and face using a napkin or a wet wipe. Step 11 is to take off your gloves and dispose of them properly. And step 12 is to wash your hands and make sure your patient doesn't need anything else before leaving their room.
I'm okay, thank you.
Thank you for watching my presentation.